All right, so you want to know about the latest in rehabilitation for critically ill patients? We're doing a deep dive today, straight to the core.
We're talking those hot-off-the-press 2023 Japanese clinical practice guidelines.
J-Recipe 2023 for those in the know.
Exactly. And what makes J-Recipe 2023 stand out
Think of this as your cheat sheet to the best evidence-based practices for recovery.
is the emphasis on the why. It doesn't just tell you what to do.
Okay, let's unpack this.
It explains the reasoning, the research,
Say you're looking at your loved one's care plan.
so you can really understand the recommendations.
Should you be pushing for a standardized approach to their rehabilitation in the ICU?
That's a big question, and J-Recipe 2023 seems to be leaning towards yes.
Mm,
Suggesting a standardized protocol can be beneficial. You know how having a clear plan often makes things smoother?
absolutely.
Less scrambling, more efficiency. Studies show standardized protocols can mean less time on ventilators, shorter ICU stays. That's huge for recovery, not to mention potential cost savings.
So advocating for a clear plan could make a real difference. Now, what about the amount of rehab? Is more always better?
It's not quite that simple. But J-Recipe 2023 suggests that multiple rehab sessions a day, think 2 or more, could be the way to go. The research is still developing, but there are hints that this might speed up recovery.
So maximizing those recovery windows, making every day count. What about technology? It's everywhere these days. Is it playing a role in rehab too?
It's incredibly exciting. We're seeing things like neuromuscular electrical stimulation, where electrical impulses basically give muscles a boost. J-Recipe 2023 suggests this could help muscles recover faster and even lead to shorter hospital stays.
Wow, so it's not just about aiding recovery, but potentially accelerating it. Incredible.
And then there's the in-bed cycle ergometer.
In-bed cycling, like those little stationary bikes you see at the gym.
That's it. Sounds surprising, but even gentle cycling while in bed can help with muscle strength and circulation. The research is still emerging, but it's promising.
Every little bit helps, right?
Exactly. And speaking of things that are more common than you might think, let's talk about dysphagia difficulty swallowing in critically ill patients. J-Recipe 2023 highlights the importance of early screening, and not just with one method,
Why not just one test and you're done?
because different methods can reveal different aspects of swallowing difficulties.
Yeah,
Imagine putting together a puzzle. You need all the pieces for the complete picture.
makes sense. So you're not just looking at whether someone can swallow, but how they're swallowing.
Yes, and this is where it gets really interesting. There's no global standard for dysphagia screening. Food cultures and healthcare practices vary so much around the world.
That makes total sense. What we consider a normal diet here might be very different somewhere else.
Exactly. Now, when it comes to managing these patients in the ICU specifically, J-Recipe 2023 advises caution on relying solely on video endoscopic examination of swallowing, or VE.
Why the caution with VE?
While VE can be useful, the research on its effectiveness, specifically in the ICU setting, is still limited. The guidelines are saying, let's not jump to conclusions based on just this one test.
Got it. Looking at the whole picture, not just one piece of the puzzle.
Right. Now, when we're talking dysphagia, we can't forget about rehab therapy.
So what do the guidelines say about rehab therapy to help with swallowing?
It seems to be a resounding yes from J-Recipe 2023. And there's growing evidence to support it. This type of therapy might actually reduce the chances of developing pneumonia.
Now that's what I call a game changer. Preventing pneumonia can make a huge difference in the ICU.
Absolutely. It's about getting back to a normal diet safely and efficiently, which of course impacts overall strength and well-being.
It's all connected. Now let's talk about getting patients moving. When is it safe to start mobilization and exercise therapy?
Safety is paramount. J-Recipe 2023 is very clear that mobilization and exercise therapy should only begin after a patient has stabilized. We're talking about after they've recovered, or at least on the road to recovery from that initial life-threatening phase.
So there's no magic checklist. It's more about the individual patient.
Precisely. The guidelines do offer a table of criteria to consider, but the final decision always involves the entire care team.
So the guidelines provide the framework, but the team applies it to each individual.
You got it. And of course, informed consent from the patient or their family, if the patient can't consent, is absolutely crucial.
Absolutely. And just as important as knowing when to start is knowing when to stop. What about guidelines for discontinuing mobilization and exercise therapy?
Again, safety first. Just like with starting, J-Recipe 2023 emphasizes having clear criteria for stopping these therapies if needed.
So you're constantly monitoring and adjusting as needed.
Right. The guidelines provide a table of criteria for discontinuation, covering things like a sudden increase in pain or fatigue, or changes in vital signs.
So it's not just objective data, it's also how the patient is feeling.
Exactly. If the patient expresses they're in too much pain or are feeling overly fatigued, that's a clear sign to stop and reassess.
It's all about teamwork and shared decision making.
Exactly. Speaking of crucial elements of recovery, let's talk nutrition.
Food is medicine, as they say.
I love that you say that. JRECP 2023 digs into energy intake, suggesting that critically ill patients should aim for either 20 kilograms a day or more, or at least 70% of their calculated energy expenditure from days 4 to 10 of treatment.
Interesting. Why focus on those specific days?
Those first few days in the ICU require a more cautious approach to nutrition.
I imagine their bodies are going through a lot during that acute phase.
You got it. So this time frame, days 4 to 10, is often when they're more stable and can benefit from a more targeted nutritional approach.
That makes sense. So why the emphasis on energy intake specifically?
It's all about fueling their recovery, especially as they begin engaging in more physical therapy.
You can't expect a car to run without any gas in the tank.
Great analogy. And speaking of fuel, let's talk about protein.
The building blocks for those muscles. What do the guidelines say about protein?
JRECP 2023 suggests at least 1 kg day of protein during that same crucial time frame, days 4 to 10. This makes perfect sense when we're talking about supporting muscle repair and growth.
It's all about giving their bodies what they need to heal. I'm learning so much from this deep dive. It really makes you appreciate the complexity of recovery.
It really is. And speaking of remarkable day, let's shift our focus to the youngest patients.
Oh, yeah.
JRECP 2023 has a whole section dedicated to rehab for critically ill children.
It's so important to address their unique needs. What does the deep dive say about their care?
One key recommendation is an early physical rehabilitation protocol. We're talking about starting as soon as it's safe. While the research is still in its early stages, it suggests there are real benefits to this proactive approach.
Early intervention is key. What about respiratory physiotherapy for kids on ventilators? I know that's a crucial part of recovery for adults.
It's just as crucial for kids. JRECP 2023 recommends considering it from the get-go, even in the acute phase. Think of it as giving their little lungs a helping hand.
So techniques to clear airways and improve lung function.
Exactly. And some studies even suggest that early respiratory physiotherapy might reduce mortality in children on ventilators.
Wow, that's huge. Knowing those interventions can make such a difference is incredible. We've been focusing on the more technical aspects of rehabilitation, but what about the human element?
That's a great point. Rehabilitation goes beyond just physical exercises. It's about the whole person, their emotional well-being, their support network.
Exactly. Having loved ones involved must make a world of difference.
You're absolutely right. JRECP 2023 has an entire section dedicated to this very topic, highlighting the importance of family involvement in the recovery journey.
So it's about creating a holistic approach to healing, involving the whole family.
Precisely. The guidelines encourage family participation, both for practical support and emotional encouragement.
What are some examples of that practical support?
It can be as simple as helping a patient get out of bed, taking a walk, or even just holding their hand. These small acts can make a world of difference to a patient's motivation and sense of well-being.
And on the emotional side, just having a loved one there must be so powerful.
Absolutely. That emotional support, that feeling of being connected and cared for, is crucial for healing.
It sounds like JRECP 2023 takes a truly well-rounded approach, acknowledging the interconnectedness of the mind, body, and spirit. We've covered so much in this deep dive. What are some of the key takeaways you want our listener to walk away with?
One of the most important is the need for personalized care. These guidelines provide a framework, a foundation, but it's up to the healthcare team to tailor the recommendations to each individual patient.
So it's not one size fits all.
Not at all. The guidelines are all about collaboration, involving the medical team, the patient, and their family in creating a rehabilitation plan that meets their specific needs and goals.
It's about empowering patients to be active participants in their own recovery.
Exactly. And another takeaway is the importance of early intervention. Whether it's early mobilization, dysphagia screening, or respiratory physiotherapy, JRECP 2023 really emphasizes the importance of acting sooner rather than later.
Maximizing those windows of opportunity.
Absolutely. And finally, the guidelines really drive home the holistic nature of rehabilitation. It's not just about addressing the physical, it's about the mental and emotional well-being of the patient and recognizing the vital role that family support plays in the recovery process.
It's about treating the whole person, not just the illness. So where do we go from here? What does the future hold for the world of critical care rehabilitation?
That is the million-dollar question. J Recipe 2023 is incredibly comprehensive, but it also acknowledges that there is still so much we don't know.
There's still so much to discover.
Absolutely. It's a field that's constantly evolving, always striving to improve outcomes for critically ill patients. And that's what makes it so exciting.
I can't wait to see what new insights the next iteration of these guidelines will bring.
I know. What advancements and breakthroughs will shape the future of recovery? What new discoveries await us?
Yeah, it really makes you think, what will the future hold for recovery? What will change? What will we learn?
It's an exciting time to be following this field, and it sounds like you've got a great grasp on the current landscape. I hope this deep dive gives you a solid starting point for understanding the nuances of critical care rehabilitation and how it impacts not just the patient, but their families as well.
JRACP 2023 gives us a powerful framework, a foundation for action. Whether you're a healthcare professional, a researcher, or simply someone passionate about this field, these guidelines offer a roadmap for making informed decisions and advocating for the best possible care.
It's about going beyond the technical, looking at the whole person, their individual needs, and their support system. It's about recognizing the power of early intervention and personalized care.
And never stopping questioning. What advancements will the next iteration of these guidelines reveal? What exciting discoveries are just on the horizon?
That's the beauty of science and medicine. We're always learning, always pushing the boundaries. So keep that curiosity alive. Keep asking questions.
This deep dive might be over, but your journey of discovery is just beginning.